Hi friends, I am Dr. Pratap Singh. I have done MD in Pharmacy Medicine, and today we'll continue with virginity, pregnancy, and delivery chapter. And today we'll discuss about pregnancy. If you go with the definition of pregnancy, so pregnancy is a phase in the reproductive period of a woman which results as a consequence of fertilization of ovum by sperm. So whenever there is a fertilization of ovum, there it leads to a pregnancy. So diagnosing pregnancy becomes has some legal importance. So we'll discuss about diagnosing the pregnancy. So it can be divided as signs of pregnancy can be divided into presumptive signs, we confirm diagnosis, diagnose the pregnancy, probable signs and positive signs which confirms the pregnancy. In presumptive signs includes like amenorrhea, breast changes, morning sickness, quickening, pigmentation, other signs, urinary disturbances, symptoms, and changes. Probable signs like enlargement of abdomen, Haga sign, Goldel signs, Palmer signs, backstaying signs, retention of development, other things. Then positive signs includes the fetal movements, presence of fetal movements, fetal heart sounds, ultrasonography, fetal heart cells. So we'll discuss about each one of them one by one. Coming to presumptive signs symptoms which confirm pregnancy. First is amenorrhea. So amenorrhea is nothing but the stoppage of menses. So whenever there is a stoppage of menses, it is called as amenorrhea. This is the earliest and one of the most important symptoms of pregnancy. Though this amenorrhea is not confirmative since women who have never menstruated may become pregnant, and pregnancy may also occur in cases of lactation amenorrhea where because of lactation menstruation will not be present. Even then there are cases are seen where the woman may become pregnant. Next present to sign is the changes in the breast. So these changes are quite characteristic in primary adult the women who are first time pregnant, but they are lesser value in case of multiparous. Usually signs includes the nipples becomes deeply pigmented, they become more erectile, areola becomes dark brown in color, the sebaceous glands also known as Montgomery glands becomes enlarged, the colostrum which is the first milk secretion from the breast is starts secreting as early as 12th week and becomes thickens and yellowish as the pregnancy progresses. At around 6 months, silver lines of stria are seen around the breast, especially in primary period due to stretching of the skin. These are all again mainly characteristically seen in primary gravidas, but not so much appreciable in multigravidas. Next, present sign is a morning sickness, that is but nothing but presence of nausea and vomiting in the early morning. So these are symptoms again which are commonly seen in case of uh, where suddenly when she wakes up there is signs of nausea and there may be episodes of vomiting. It usually appears at the end of first month and it disappears usually at the end of third month. Quickening, that is the first appearance of fetal movements. So first appreciation. So this is the first appreciation of fetal movement, which is also known as quickening. It is seen about around the 18th week, which may be seen early in multiple. Since she becomes experienced, can appreciate fetal movements earlier. The pregnant woman feels slight fetal movements in her abdomen at the around 18th week of pregnancy. Then there is pigmentation of skin. So pigmentation may be seen in the vulva, abdomen, and axilla, which becomes darker due to deposition of pigment, and dark line extends from pubis to beyond the umbilicus, which is also known as linea nigra. So this is the deposition of the pigments, which is seen maybe from extend from pubis to umbilicus. This is also known as linea nigra. There is also pigmentation of vulva and abdomen and axilla because of deposition of pigments. Again, these are presumptive signs which may not be always seen. Then presence of chloasma, that is pigmentation over forehead and cheek, which may appear around about 24th week. Then Jacquemus or Chadwick sign. Here the mucous membrane of the vagina changes from pink to violet color because of deepening, because of venous obstruction. It is also color may change to deepening to blue. So it may change from pink to violet to blue, which is mainly results because of venous obstruction at about 8th week of pregnancy. Next is the urinary disturbances. The urinary disturbances are usually because of compression of uterus on the bladder. It usually starts during 8 to 12th week of pregnancy. The enlarging uterus exerts pressure on the bladder and produces frequent micturition. This subsides as the uterus enlarges, and again it becomes prominent at the end of term, since it the has head descends into the pelvis. Again, the urinary disturbances becomes frequent. Fatigue. So women get easily fatigue is very frequent. Then some symptomatic disturbances are seen like salivation, altered appetite, irritable temper, which are commonly seen in preemies. It may not be appreciable more in multigravidas. These are all presumptive signs of pregnancy. Now coming to probable signs of pregnancy. First of all is the enlargement of abdomen. So this has the pregnancy progresses. The abdomen gradually enlarges in size after 12th week of pregnancy. So you can see the third month to fourth to fifth month it is present near the umbilicus, and as pregnancy progresses it reaches up to sternum, and has head descends again at around 10th month it descends into the pelvis. During last 2 months the uterus sinks into the pelvis and tends to fall forward due to its weight. Next probable sign is the Hagar's sign, which is positive between 8 to 10 weeks. At, at around this 8 to 10 weeks, there is softening and compressibility of cervical isthmus, which can be appreciated by compressing the cervix between the fingers from the vagina and as well as the abdomen. This is the most valuable physical sign of the early pregnancy. Next is Godel's sign. This is also similar to Hagar's sign. It is seen as early as 6th week, in which the cervix progressively softens and from below upwards. So this is expressed as feeling where cervix feels like lips in pregnant woman, and it may, as compared to non-pregnant women, it feels like a tip of the nose. So that is the Godel sign. Next, Palmer's sign. In this, there is a regular rhythmic contraction of uterus, which can be elicited by bimanual examination as early as 6 to 4 to 8 week. Then Osander's sign. There is increased pulsation felt through the lateral fornices of this from the vagina about 8th week. Then there is Piscaxis sign. In this, there is asymmetrical enlargement of uterus occurs if there is a lateral implantation, and there is Baxter's contractions. So this is the very commonest sign. Here there is intermittent spasmodic painless uterine contractions which are observed rarely below the third month but are easily felt after fourth month. So this contraction which are intermittent and spasmodic are appreciable till the even in as pregnancy progresses, and they are also present in case even if the fetus is dead. The fetus is even dead, it is present. Next is ballotment, that is the tossing like a ball. So in this, this is a positive during 4th to 5th month of pregnancy, as fetus is small in relation to amount of amniotic fluid. So in this case, the fetus can be easily tossed from side to side. That is ballotment. So external ballotment, if you in the abdomen, if you tap from one side, then the fetus which is present inside the abdomen can be tossed from side to side. It can be felt from the other hand. If your hand is placed in this side, if you press from this side from the abdomen, the fetus will move inside the abdomen, which is called as ballotment, which is external ballotment. Internal ballotment can also be elicited by pushing through the vagina, which can be felt on the fundus part of the abdomen. This is again the probable signs of pregnancy. The uterine shuffle, which is a soft growing murmur which is synchronous with the mother's pulse. This is mainly because which can be heard towards the fourth month by auscultation and other side of fetus because of passage of blood to the uterine vessels. So since because changes in the pregnancy, there is a soft glowing murmur can be appreciated because of blood flowing through uterine vessels. In certain biological tests, so these are based on the reaction of test animals to human chorionic gonadotropin (HCG) in pregnant women's serum or urine. This is not done, and this is usually nowadays not done also. Usually, the test which is done is the immunological test, where HCG is detected in the pregnant urine of the pregnant woman. So HCG can be detected in maternal serum or urine by 8 to 10, 11 days of conception, which reaches about maximum by 10 to 11 weeks. Test is not reliable after 12 weeks of pregnancy. So immunologic tests have replaced biological tests for routine screening. So biological test where the human serum or urine was injected into the animals nowadays is stopped. It is not done. Nowadays, immunological tests are done where anti-serum, there is a kit are available, immunoassays are available where if urine is dropped, which consists of HCG, reacts with anti-HCG with pigmentation and creates bands which can be detected as positive signs of as positive uh, presence of HCG in the urine. So first wired urine in the morning contains the highest level of HCG and it is preferred for testing. So it usually detects only presence of HCG. So in case it is also present, it is also positive in case of ectopic pregnancy or in case of presence of identiform mole also. In this case also it is positive. Then next is the positive signs. So these are the confirmatory signs, conclusive signs of pregnancy. So these are confirmatory signs which tells that the woman is pregnant by sure. First is the fetal movements, presence of fetal movements. The palpation of fetal movements on the abdomen is a confirmatory sign. The fetal movements and fetal parts can be identified as distinctly by 20th week and the abdominal palpation. So you can easily uh, feel the hands, limbs, as well as the back of the fetus. Then presence of fetal heart sounds, which are definite signs of pregnancy. They are heard between 18 to 20th week with ordinary stethoscope. This can be differentiated since the fetal heart sounds are faster. It ranges from 120 to 140 beats per minute, and it can be differentiated from mother heart by palpating the radial artery. The fetal heart sounds are sometimes not audible if it is before 18th week of pregnancy, if the fetus is dead, if the fetus is hydroamnios, that is excessive quantity of liquid amnion is present, in case of obese patients, or fetal positioning in such a way is that which prevents the transmission of sounds. In these cases, sometimes fetal heart sounds may not be heard even though fetus is present, even though the woman is pregnant. Then radiological examination, this is not done. So even though it is confirmed it's sign, but it is not usually done. In this, the fetal has scattered shadows of vertebrae disc looks like visible like uh, dots can be appreciated about 60 weeks of pregnancy. Vertebrae column can be easily appreciated. The confirmatory test, which usually routinely done, is the ultrasonography. So ultrasonography is the gold standard test to confirm the pregnancy. From ultrasonography, interdecidual gestational sac is identified as the latest 29 to 35 days of gestation. Gestation sac, yolk sac by 5th menstrual week, fetal pole, embryonic movements by 7th week. So ultrasonography can detect gestation sac, yolk sac, fetal pole, and embryonic movements around of 4th week. Even at the earliest 7th week, it can detect. Then transverse sonography can detect cardiac activity by 5th week and transabdominal sonography by 6th week. Doppler ultrasound can pick up fetal heart rate reliably by 10th week. So ultrasonography can detect, confirmly tell that woman is pregnant by as early as 7th week of 5th to 7th week by presence of fetal heart sounds, which can be done by transvaginal ultrasonography. In presence of fetal cells in mother's blood. So fetal cells can be detected in mothers by presence of 5th week of pregnancy. This is also confirmed the woman is pregnant. Then those are the positive signs of pregnancy in living cases. Now coming to diagnosis of pregnancy in dead. So in dead, if the woman immediately, most probably sometimes these cases of criminal abortion comes, in that cases we have to confirm that the woman is pregnant. So all the signs of pregnancy which we have discussed in the previous slides will be present in even in the dead. External signs mainly like presence of pigmentation, changes in the breast, changes in the abdomen, changes in the will be present. Even including that, there will be presence of embryo or fetus or placenta tissues may be present inside the uterus, which is a positive proof of pregnancy. There may be enlarged and thickened uterus may be seen. Or if there is a aborted fetus, if the fetus is aborted, there may be presence of corpus luteum in the ovary, which is a corroborative evidence to confirm that woman was pregnant at the time of death. Now coming to molecular aspects of pregnancy. So many times diagnosing the pregnancy confirmably becomes important in certain cases where woman may claim pregnancy to avoid certain situations like execution of judicial death sentence. If a woman is sentenced to death, she may claim she is pregnant to avoid death sentence. So when a woman is sentenced to death, she may plead that she is pregnant to avoid execution. So if she is pregnant, then according to law, the pregnancy till the child is born, after 1 or 2 months, the death sentence can be delayed. Differing trial of such case. And the woman pleads pregnancy to avoid attendance as a witness in the court. So as we know, if the summons occurs, it has to be attended. But sometimes woman may plead she is pregnant and her dates are coinciding with the court date, and she may plead to not avoid the witness in the court. Feigning of pregnancy and delivery. When a woman feigns pregnancy soon after the death of her husband and later produces child to claim greater share of property or compensation. So in this case also confirming that woman is pregnant or not, it becomes important. Criminal breach of trust or rape. When the pregnancy is claimed to be result of rape, kidnapping and seduction or breach of promise of marriage. Then blackmail. When the woman may blackmail a man, claims that she is pregnant by him by to compel marriage. She may also produce a supposed child, that is a false child, where she has not given the birth, but she may bring a child from some other woman and claim that it's her child to extort money. In case of disputed chastity, when allegations of unmarried woman or widow or a wife living apart from her husband that she is pregnant or delivered a child. If a woman questioning of chastity arises when if she becomes pregnant and she is living separate from her husband. In case of homicide or suicide, where the woman is alleged to be of pregnancy is alleged to be a motive for murder or suicide of unmarried woman or widow, where she may claim that she is pregnant because of that she committed suicide or tried to commit suicide or tried to commit homicide. In case of affection cases, where a woman may claim a child fathered by her husband who has subsequently divorced her by a person or by a person who is not her legally wedded spouse and force him to adopt the child on his own and pay maintenance allowances. Where so then in these cases, like if she has not married to a one person and she may claim that the child is of that person and may try to get the compensation money from him. Again, in these cases, pregnancy, eliciting the signs of pregnancy becomes important. Concealment at birth. In case of alleged concealment of birth or pregnancy in an unmarried woman or widow or out of wedlock. Again, in these cases, signs of pregnancy has to be elicited to in case of marriages. Criminal abortion and infanticide. When there is allegation of sex selective abortion or killing of infant, in this case, we have to confirm that the woman was pregnant and has been undergone abortion or not. In case of nullity of marriage or divorce, when there is allegation of woman becoming pregnant when the husband was not having access to physically. So if the woman becomes pregnant and if husband and wife are living separately, even then if they become she pregnant, it may lead to the case of divorce and case of adultery, and it may also lead to nullity of marriage. In case of maternity or paternity leave, where for claiming benefit of leave, sometimes the person may tell that she is pregnant, or a woman may claim her wife is pregnant and try to get the paternity leave. In case of legitimacy, for such claims, it must be proved that the woman indeed delivered a child at the time of claimed by her. In that case, also legitimacy of a child, if it is born of unmarried woman, in that cases also it becomes very important. Next condition is the pseudocyesis. This is one of the medical importance, where it is also known as superstitious false or phantom pregnancy. It is a psychological disorder where the woman has false but firm belief that she is pregnant, although no pregnancy exists. So here, woman has psychological, he thinks that she is pregnant, though she may not be pregnant. It is generally observed in infertile females or women nearing menopause who desires a child intensely. So it is usually seen in children's early women or women who are nearing menopause who intensely desires a child. In those cases, they are seen. Most of them women are suffering some form of psychic or hormonal disorders. In these cases, patient may present with all the subjective symptoms of pregnancy. So though they are not pregnant, they appreciate fetal movements like intestinal movements or falsely thinks that fetal movement, if intestinal movements has fetal movements. There may be enlargement of abdomen because of overeating, and she may become obese and may she think that she is pregnant. This is a condition called as pseudocyesis. Again, in these cases, we have to confirm that woman is pregnant or not. Then condition like superfecundation. So in this case, there is a fertilization of two ova discharge from ovary at the same period of ovulation. So at one ovulation, usually one ovum is released, but in certain conditions, two ova are released at the same ovulation period, and they may be impregnated by two separate acts of coitus committed at short intervals or by two different fathers. So in these cases, if there is a gross variations in the complexion and features of the two babies may give rise to doubt of adultery and infidelity. So if in case of two ovaries, one may be fathered by one person and one may be fathered by other person, and the complexion like one the child may be may have lighter complexion, other child may have darker complexion, which may lead to a case of adultery or legitimacy case may be arise. Similarly, there is also condition called superfetation where there is fertilization of second ova discharge from the different period of ovulation. So one period of ovulation there is one ovum which develops to one baby, and at the same when there is she is pregnant, there may one more ovum may be released at the other period of ovulation, and that ovum may also start may get also impregnated and develop into one more baby. So if the fertilization of second ovum is in the it is a fertilization of second ovum in the pregnant woman. In this case, one fetus may always remain more developed than the other and may be born either at the same time, showing different maturation, or may be born at different periods varying from 1 to 3 months. So in this case, one baby will grow larger, other baby will be less mature, or it may die also, leading to fetus compresses. These are my references. Thank you.